Hand, foot, and mouth disease is surging in the United States. And in general, this is a virus that is relatively mild and patients should get better within a couple days. That said, parents consistently report that this virus can feel like the worst week of their life because of the incredible pain that it causes kids. To start off, hand, foot, and mouth disease is a viral illness. It's caused by the family of viruses called enterovirus, usually this Coxsackie virus. Main point to remember is, like many pediatric illnesses, there is no direct therapy for this virus. So what you really have to do is supportive care. You can't treat it directly. The virus is super transmissible, so it comes in basically all of a kid's bodily fluid. So saliva, throat secretions, mucus, nasal discharge, even feces. So washing hands and cleaning off surfaces is really important to prevent spread. If your child does come down with the virus, the presentation is usually sore throat, fever, and then the development of this painful red and then blistering rash on the palms, soles, the feet, can be around the buttocks and genital area, and then especially in the mouth. The blisters in the mouth are usually red, they then form a vesicle or a little fluid-filled pocket which can rupture. The ones in the mouth are super painful and the root of all the problems. On the extremities, in general, they're not painful, so they can be, we say, asymptomatic, but there are definitely variable presentations. Some kids get a little itchy, and then some kids can have pain as well. I do want to make one quick note here. So when parents see a rash in and around the mouth, they usually think, oh, this must be hand, foot, and mouth disease, and that is most likely, but two differentiating things just to think about. So if a child gets a primary herpes infection, so a herpes virus infection around the mouth, it can actually look quite similar. In general, you won't have the rash on the hands, feet, or buttocks. And additionally, if you do have skin lesions, it tends to occur on one side of the body, not on both. If you think your child has a herpes infection, you really should get them evaluated because there is a treatment for that called acyclovir, and the pediatrician would want to know about that. And the other thing, becoming more and more common in the United States because of vaccination practices, is measles. So measles also can present with oral ulcers, and these are called Koplik spots. But remember, the presentation is pretty different. So this would be, we say, cough, conjunctivitis, and coryza. So it starts off with a cough, runny nose, and red eyes. Couple days later, that's when you see the oral lesions called Koplik spots, and then it progresses to a very different rash. It's a descending rash that starts up on the face and moves down the body. So not the same as hand, foot, and mouth disease, where you're really seeing on the extremities or around the buttocks and genitals. Okay, so with that out of the way, how do families treat their children? Well, the name of the game is prevent dehydration. As mentioned, there's variable pain on the extremities, but man, these oral ulcers can be super painful, so that's the focus. First, to start with evidence-based therapies, it's Tylenol and ibuprofen. So any infants over 3 months can get Tylenol to help with the pain, and then any infants over 6 months can get ibuprofen, and just give it according to the packaging instructions. It's best to give these medicines usually like 30 minutes or so before a meal to really help the child be able to take things in. In terms of what to eat, trying to focus on soft foods like yogurt or jello, and then cold foods like ice cream, milkshakes, or popsicles will generally help. You really want to avoid anything that's super salty, acidic, or spicy. That could make things way worse. Okay, and beyond that, there's not a lot that's truly evidence-based, but there are topical therapies that are often worth a try if your child's really feeling pain. So you can either go to the drugstore and just use a topical antacid, so something like Mylanta. If you have a 1 to 6 year old, you can just put a few drops in their mouth or use a cotton swab to try to apply them to the sores and let it sit there. And then if somebody's over 6 years old, you can take a teaspoon or 5 mLs and let them swish it around. And again, you'd probably want them to spit it out, but if they swallow it, it's not that big of a deal. There's also something called Magic Mouthwash, where you can actually take half Maalox or an antacid and then half liquid Benadryl and do that same thing to apply it to the lesions, and sometimes it can reduce the inflammation and make them feel a little bit better. One thing to really avoid though, some people who make Magic Mouthwash include other medications that are really topical anesthetics. So I'm talking about something called lidocaine or benzocaine. It's really recommended that you avoid these medicines. There's no data that they will really improve outcomes, but the child can absorb them and then have systemic toxicity, so best to avoid. For the extremities, as mentioned, usually that's not the focus for kids. It's not the most painful thing, and so no particular treatment is necessary. Just remember that when those blisters open up, the liquid inside is super contagious, so try to just keep them clean, wash hands, and prevent spread. So with all that, the usual course for kids is the worst symptoms last 3 to 5 days, then they start to recover. Total symptom duration is 7 to 10 days, and most kids can be managed at home or on an outpatient basis. They don't need to be admitted to the hospital. Where you get into trouble is if your child gets dehydrated. So I have a separate video on that to review signs of dehydration, but especially for me, if a child is ever not acting like themselves, so they have altered mental status, if you see them breathing really fast, or we use the word tachypnea, and then especially if you notice reduced urine output, those are 3 just kind of alarm bell signs to me that, hey, this has gone too far, gotta get to the emergency department, probably get some IV fluids, and maybe even get admitted to be taken care of. The last thing I'll say, super rare complications, but central nervous system infection can occur. So there are things like encephalitis, Guillain-Barré syndrome, or other neurologic disorders that can happen. So if you notice your child is just not acting right, they're stumbling around, they're not responding like they normally would, they're super passed out and lethargic, these are also reasons you would really need them to get evaluated. All right, so that's it for now. It would be a huge help if you found that useful to subscribe, leave a comment or like, and yeah, we'll see you on the next one.